Good.
Yeah.
Okay. I would like to call the regular session to order at 6:38 p.m. And we'll note that we have no reportable actions from closed session. So with that, could we have our roll call, please?
Director Burnwick, Director Goodfellow,
Here.
Director Garcia,
Here.
Director Berger,
Here.
Director Rivas,
Here.
Director Eagle.
May we all stand for the pledge of allegiance? And again, I pledge allegiance
to the flag of the United States of America, and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Item 4, we have no request for approval for remote appearances. So I will consider approval of agenda. In the case of an emergency, items may be added to the agenda by a majority vote of the Board of Directors. An emergency is defined as a work stoppage, a crippling disaster, or other activity that severely imperils public health, safety, or both. Items on the agenda may be taken out of sequential order as their priority is determined by the Board of Directors. The board may take action on any item appearing on the agenda. So do I have a motion to?
I so moved.
We have a motion by Berker,
I'll second.
second by Garcia. Any discussion? All those in favor say aye.
Aye.
Opposed? Motion carries. Public comment. At this time, the board will hear comments on any agenda item. If any person wishes to be heard, they shall stand, address the president, or in this case, the vice president, identify themselves and state the subject for comment. Time limit for each speaker is 3 minutes individually per item to address the board. Individuals who wish to speak on multiple items will be allowed 4 minutes in total. A total of 15 minutes shall be allocated for each item for all members of the public. The board may find it necessary to limit the total time allowable for all public comments on items not appearing on the agenda at any one meeting to 1 hour. Do we have any comments from the public? Welcome to the meeting, by the way. Thank you for coming. No comments? Okay. Then moving on, we have our consent calendar. And any member of the board may request that items for the consent calendar be removed for discussion. Items so removed shall be acted upon separately immediately following approval of items remaining on the consent calendar. So we have the approval of the minutes for the meetings of January 8th, 2026. Approval and file PMH expenses / financial report, December 2025. Do I have any discussion or motion?
No discussion, but so moved.
Okay, we have a motion by Berker, second by
I second.
Valdez. All in favor, say aye.
Aye.
Opposed? Motion carried. That brings us down.
Madam Vice President, section 7.
Number 7.
Oh, sorry, I'm in a hurry. I just skipped right over that. We have board comments, and we actually have some important board comments because we have some news from our finance committee. So, with that, reports on meetings and events attended by directors, authorization for directors' attendance at upcoming meetings and or events, board of directors comments. So, brief reports by directors on meetings and events attended. Anyone have any?
Yes, I attended the Women's Auxiliary board meeting, and they have asked me to speak on the 27th of this next week in regards to so.
Okay. So schedule of upcoming board meetings and or events.
We'll take that when we take the,
Calendar.
yeah, the item, item P. So we'll pick it up on item E during
Okay.
9. Yeah.
We have our proposed council, perfect. And report by merger strategic planning.
Nothing significant since the last board meeting. The strategic planning ad hoc continues to meet at least weekly to discuss progress of the merger. And we expect to have another update at the following board meeting.
And our finance.
Thank you. Our finance committee met on the 19th at 10 a.m. And at that meeting, we reviewed the financials and you'll see those in the consent agenda. Then we also recommend to move forward with, recommend to the board to approve the following items that you'll see as action items. 9A, staff, the approval of notable annual solutions. That was approved with, that was recommended, by the way, let's see here, with the subject to the change of some legal language changes that was recommended by our legal and Harley Loper. And you'll see that in the packet. We'll discuss that more. And also 9B, we also recommended for approval the renewal of the contract with Agility Equipment Services with subject to revisions also. We'll hear more about that as well. And then also 9C, we approved the we actually recommended for approval to the board the item C that you'll see an action item regarding the Canon of Leo I-700, and also 9D, the renewal agreement between Pro Valley Healthcare District authorizing the transfer of all Central Regional Medical Center frozen retirement income plan.
Here, it's Rady's Children's.
Rady's Children, how did I get in? Yeah, I'm sorry. Yeah, scratch that. Our agreement with Rady's Children's Hospital, thank you. And so just for clarification, we recommended for approval the agreement we put between with Rady's Children's Hospital. And also 9E, with the correction of a typo, we recommended also the authorization for the legal to authorize the law offices of Stephen Baquisto and Coleman Legal Professional Services as well. That concludes my report.
So we already did the consent calendar since I got you switched around. So that brings us to these items 9, A, B, C, D, and E that have been reviewed by the finance committee and recommended for approval. Do we have any questions or discussions? If we want to take them one at a time, or can we take them all together?
You can take them all together. My only note is the version in the packet, the changes that we discussed at finance committee are reflected in the yellow highlight in the version in the packet. So the version in the packet is the version recommended for us.
Any questions, Mr. Vaughn?
So I so move that we approve items 9A through E.
I second.
Okay, we have a motion by Berger, a second by Garcia. There's no further discussion. All those in favor say aye.
Aye.
Opposed? Motion carries. Thank you. So that brings us down to 9F, discussion or no action on the benefits broker.
So in your packet, you'll see the response from the RFP that we put out to a number of different brokers. The group that we're proposing to the board at this point in time is the Alera Group. Alera Group is they're the 11th largest broker in the country. One of the things that makes them special and unique for us in our scenario is they do specialize in rural health in particular. So one of the groups, a couple of groups that we actually had were larger groups that, it would be the same broker that does us, that does the tractor guy down the street, that does the grocery store, that kind of thing. One of the others that we looked at was probably one of the largest in the country. Had a lot of great stuff, had an actual healthcare section in it. But again, much larger group from that standpoint. Alaria Group is actually endorsed by two of the largest rural health groups or organizations in the country. And the feeling was, as we went through the process, from the Alaria Group in particular, they have a part of what they offer is what's called a capitated model. And so it's like another layer in there for us. So you see in there, they came in at about 185,000 or 180,000, excuse me. And the cheapest group that we had came in at 175. And the most expensive group that we had came in at about 235. So they're pretty close to the low end, but they also have that opportunity for us to be able to save some money on the capitated model, because that would be money coming back to us through that process. They have a really good employee portal and education piece that comes with them as well. And there's a lot that they can do for us from that standpoint, from a customer service. And that was really the feeling that those in particular who would be dealing with them on more of a day-to-day basis, really liked that customer service feel that came from the Alaria Group. And so for those reasons, we feel that they would make the best fit for our organization at this time with what we're doing and coming together, and really trying to focus more on our staff and the experience that they will have through this process. We think that all of them, we narrowed it down to three from all of them that came in, and out of all those three that we narrowed it down to, all three would be able to produce a pretty good end result as far as what the benefits would actually look like. And so it really came down to the customer service piece and making sure that our staff were going to be taken care of from that standpoint, which is why we chose to present the Alaria Group before you today for approval to move forward. Many, like what they'll do is they'll put it out to bid, and when they come back with, they'll show us. So that's the TPA service that will be used. So it'll be whatever that comes back at and what those guys will choose to put into that bid at that point in time, and they'll present that to us. And that'll be a choice that we'll make for that TPA and the PBM as well.
One of those little sheets with this one that explained this in that legal has.
So legal actually has their contract right now. It was this all happened very recently. And so we got that, I think it may have been Tuesday that I got it over to Adriana, and then I sent our BAA to them as well. So their folks could look at our BAA, and then our folks are looking at the actual service agreement and what that looks like. So the idea will be that we'll get that turned around fairly quickly, because whether it was this group or any other group that we were going to utilize at this point in time, their runway is very short with the time frame. And that was some of the questions that we had for the groups as we talked about, this is what it's going to look like, and here's a short runway that you have this first go around. And so we really need to make sure that you can handle what we're about to throw your direction. And so this one, again, the cost on that is $180,000 a year.
So moved.
I'll second.
And we have a motion to approve by Bertha, seconded by Garcia. Any other questions or discussion? Hearing none. All those in favor say aye.
Aye.
Opposed? Motion carried. Thank you.
Yep.
Next is Item G, which is consideration and approval of resolution number 2026-0122. Resolution of the Imperial Valley Healthcare District authorizing transfer of El Centro Regional Medical Center Frozen Retirement Income Plan.
Thank you, Madam Chair. I'll take this item. Resolution 2026-0122 is included in the agenda packet. It's a heavy lift. It's over 200 pages long because it includes what this resolution does is contingent on the closing with El Centro Regional and City of El Centro for acquisition of ECRMC, and effective as of the closing date, IVHD is going to accept the assignment and transfer of the frozen pension plan and all of the plan documents, contract liabilities and responsibilities and obligations. And it is also a resolution that would approve the trust agreement, the client services agreement. So these are services agreements that go along with the frozen pension plan so that the frozen plan can continue to be administered for the folks that benefit from it. And the consulting services agreement. So if closing is for whatever reason, which we do not anticipate, if closing is not consummated, the resolutions would become null and void. This is only effective. IVHD's assumption of the pension plan is only effective upon closing. It also designates to the CEO of IVHD or his designee, the authority to act and carry out the purposes of this resolution, which is executing and delivering all instruments required to effect the intent of this resolution, which is to transfer the plan over to IVHD. All of the plan docs in substantially final form are included in the agenda packet, and I'm happy to answer any questions.
That's right. Then I will entertain the motion.
I'll make a motion to approve.
We have a motion to approve by Garcia. Is there a second?
Second.
Second by Berker. Any discussion? All those in favor say aye. Opposed? Hearing none, motion carried. So that brings us to H. Is the Whitley professional phase 2 services. Okay.
I can take it and the problem, yeah, so this is a continuation of the items from last board meeting where the board approved Whitley phase 1 for the tax analysis, debt capacity analysis. Whitley was engaged following the board meeting on the 8th. We executed the professional services agreement for a services agreement with Whitley for phase 1 in the amount of $25,000 on January 13th. Consistent with the board's direction, staff went back and renegotiated with Whitley the scope and cap for phase 2. The previous range was, I believe, 135 to 225 or around there. And this new range has been revised to between 100,000 and 175,000. So this examination level feasibility study will assist with long-term financing solutions for IVHD. The professional services agreement, which is included in the agenda packet, attaches the proposal as attachment A, scope of work, and institutes a cap of $175,000 in section 3.01, so that the engagement cannot go above that $175,000 cap without coming back to the board for amendment. And happy to answer any questions.
Yeah, we've already discussed this, so it was just the pricing.
Yep.
Okay. So I don't know if this director of all those having questions from your team. Yeah, okay. So with that, I would entertain a motion to approve the.
So moved.
Second.
So we have first by Berker, second by Garcia. All those in favor say aye.
Aye.
Opposed? Motion carried. And that brings us down to I, which is, well, actually, we have, it looks like we have some policies and procedures. Which is I, J, K, L, M, N, O. N.
I so move that we approve the policies and procedures I through O.
Second.
Do I have a second? Okay, so we have a motion by Berker, a second by Valdez. Any other discussion? If not, all those in favor say aye. Aye. Opposed? Motion carries. Thank you. So now we are down to item P, our proposed 2026 calendar for regular board meeting.
So, consistent with the last board meeting discussion, we prepared this calendar, for 2026, regular board meetings. The regular board meetings are in red, outline. And then depending on location, baby blue is Pioneers, green is El Centro Regional, and orange is the Calexico facility. We also threw in the finance committee meetings, which are actually set by the finance committee bylaws. And those are, just for the record, incorrect for March, June, August, and November, because the bylaws actually state that the meetings will be on the fourth Monday. And these reflect the last Monday of the month instead of the fourth Monday. So the corrections will be for March Finance Committee, unless the Finance Committee changes anything. Finance Committee will be March 23rd instead of March 30, June 22 instead of June 29, August 24 instead of August 31, November 23 instead of November 30. The purple outline in October reflects the Association of California Healthcare Districts annual meeting, which the board attended last year. So you'll see that it overlaps with the October 8th regular board meeting. So for discussion is whether you want, last year you moved that. I think you moved it to be a week earlier. So it's worth, I think, discussing if you intend on going to ACHD again this year, you want to go ahead and move that now to October 1 or cancel it, or October 15. The other thing to point out is November and December, consistent with last year, only has one board meeting because the second board meeting of November is Thanksgiving Day and the second board meeting of December would be Christmas Eve. So I left those, but you tell me, if you want to see any changes. Other ideas that have been proposed is maybe having only one meeting in one of the summer months instead of two. You guys tell me what you want, and then the board can approve a revised calendar and we'll get that up on the website.
I agree with the, on the finance committee to make those adjustments so that they line up with the second board meeting of the month. And then also, how does the finance committee feel about changing our regular time to 10 a.m.? And how does the staff feel about that? Since we ended at 10 a.m. this week, did you guys feel good about that? Did that work out?
Yeah, probably, yeah.
So, I would,
I'll change it to reflect 10, and then we'll also talk about that. I'll put that on the agenda for next finance. It's revised, I think it's in the bylaws, we'll just bring recommended bylaws.
The other thing that I would float out there that some groups do is they do a combined one for November and December, like generally like the first part of December. And so you can capture some of the November in almost all of November, but then you just have that one in there instead of trying to do two. And it's a way to kind of get away from all the potential issues with the scheduling and things like that. So, but that would be, instead of doing one on the 12th of November and on the 10th of December, you could do one on the 3rd of November or December and account it for both those months.
I just worry about the business that we have to take care of though.
Well, by that time, hopefully, we're gonna have, like, we'll be in a much better spot than where we are right now. Like ideally, we wouldn't have to continue to do two going forward, and we would do one, and generally, like we mentioned before, we'd like to do that towards the end of the month. So like the ones that we have like on the 25th and 24th and 27th, those type of numbers, whether it's Thursday or not, is up to you guys as well. But the doing it like that, we can have one meeting instead of two, because what should happen with, once we get to the point where things are calming down from the merger perspective and all the stuff that the board will have to do from some of those other committees, will transfer into your standard committees. And those standard committees will happen during the month. And then you have one board meeting that would take care of all the business for that, like we do now, instead of having multiple. And then if you do it like that, again, it's a way to get all the November stuff and taken care of, and then some of the December stuff that will be needed, and then you start again in January. But that would be a recommendation that I would put out there. Obviously, I defer to Pablo as well, as far as like, it's gonna be more him from that standpoint, so.
It doesn't matter to me, as long as the
Me
board.
Yeah. I think changing the finance meetings, as Adriana had mentioned, and then I'm fine with the rest of the comments. If anybody else has problems with it.
Do you want to keep the October 8th, or do you want to move that now if you know you want to go to ACHD?
I think we all would like to probably attend that again. So
Where is it this year?
It is. I think they alternate between Northern and
Yeah.
Southern California. So this year,
Monterey.
Okay.
Are you trying to sell this?
No, I'm just saying, that's where it is.
I'll be there next week.
Beautiful part of the state.
Yeah.
So on that one too, just so you guys, if you look at the way that it falls in the calendar, wait, never mind,
yeah, 2026
the 20.
annual meeting, yeah, Monterey Marriott, October 7th through 9th. You can also,
Just do one.
send two of you or something as ambassadors to come back and report to the full board on what you learned.
And just on part of that too, be mindful of that, because one of the things that they do at that meeting in particular is you guys will get your 2 hours of ethics training or sexual harassment training, which is a requirement that you'll have for the board as well. So if you have another means to be able to do that, then that's an option too. Otherwise, they do take care of that there. And I want to say that there is, it could be something where I think the 7th itself is a board specific day, and that is when they would do the training, and they have board specific training and stuff on that day. So it could be something as well where it can just be done on the 7th, and you don't have to, not everybody or no one has to participate in the other 2 days associated with that. So there are kind of multiple options when it comes to that one.
I think we probably should just remove it, and then if we need to call a special meeting, we can.
So just remove the meeting on the 8th?
Yeah.
Okay, and then leave the purple outline of ACHD just so we have that on the calendar. Okay.
I would only, besides, I have a conflicting conference, the 6th through the 8th on there. So it'd be kind of hard. I wouldn't be able to attend the entire conference. Already good.
Like you would be out on the 8th anyway, so, yeah, I think we should just,
Take it off calendar.
Take it off.
Okay.
because we may be positive that we could be in a good position to where we really only need one meeting.
Yeah.
You're revising all
Yeah.
of this, which
Well, and
I,
starting October, it is one meeting. It would be one meeting October, one meeting November, one meeting December, so.
if we take off the 8th, so.
Okay, so to recap, making those edits to finance committee for March, June, August, and November with a 10 a.m. start time. taking the October 8th regular board meeting off calendar. Everything else stays the same. Yes, please.
I would entertain a motion to,
I so moved
A second.
we have
with the changes.
a first for approval as amended from Berker, a second from Garcia. Any other discussion? If not, all those in favor say aye.
Aye.
Opposed? Motion carries. Thank you. So next up is the approval of amendment to professional service agreement with Rami. Oh dear, I'm so sorry.
Georges.
Georges MD for urology services.
Carly and I can tag team this one. The board approved many months ago the professional services agreement with Dr. Jurgens for urology services. Since then, most recently, Dr. Jurgens has requested that we pay his LLC instead of paying him directly. But of course, the agreement is with him, and so we can't do that until we amend it. So we're still evaluating just on the tax regulatory side to make sure our ducks are in a row with the agreement. But we don't anticipate any problems. All we have to do is go through the agreement and draft an amendment that basically directs the LLC to take on the obligations of Dr. Jurgens and make sure that they're employing, credentialed position, because he will then pay himself from the LLC. So that is the request, is to approve an amendment that makes just those changes. If you want to table this so we can bring back the actual amendment, we can do that. But if you're otherwise comfortable with approving an amendment that only changes the PSA from Dr. Jurgens to his LLC, you can do that today as well, because there's no financial change. There's no impact on the money or terms. It's really just the party change.
Yeah, and as long as you're doing your due diligence, I'm fine with it.
Is that a motion?
Okay, so I so moved.
Was
No
that
more
a second?
That was second.
Second.
I mean, I don't want to twist your arm or anything. We have any other discussion? I do have a first by Berker and a second by Valdez. Is there any other discussion or questions? Are we comfortable to go ahead and vote on that?
Up to you. No further discussion from my end necessary.
Okay, so all those in favor say aye.
Aye.
Opposed? Motion carries. Thank you. Okay, that brings us down to management reports. Do we have anything from
He's out, but we can answer any questions that you guys might have. I know most of you guys have already heard that, but Director Valdez would like any questions answered, we can. Okay.
The finance.
They said also say that we're ready for part of that, so.
We already went.
I guess for the benefit of those of you out there that may be wondering, our finance committee is, our president is Mr. Garcia, vice president, Ms. Berger, and I'm the third member. So that's why a lot of this we've already seen. And we just want to make sure that Director Valdez, if he has any questions or concerns for us, we give him ample time to voice those concerns. So we don't want to leave him out in the dark. So, thank you. So with that, Harley, for our hospital operation. Cheryl, sorry.
The other side.
Okay,
Too many feet.
yeah, I should know that. I guess I was actually skipping down. I'm skipping all over the place.
She really is wanting to.
I shouldn't look, I shouldn't look up and look down. I lose my place.
Me
So,
neither.
yeah. Hospital operations, Carol.
So good evening, everyone. So I have the CNO report here. It's for January. You can see the transfer report. It does have a summary. So for this time around, I showed you for the 4 quarters and then the totals for the year. And so We did have 1,376 transfers from the ER department, which is a 2.89% when you look at the number of ER visits that we had. You know, everything was pretty much the same as always, the top three being cardiology, GI, neurology, neurosurgery, and neurology. So no changes there. There's a lot of work being done between the two campuses and the physicians, Dr. Vaughn and Dr. Nelson, in terms of making it easier to transfer when we have to transfer, making it an easier process for the physicians, but then also to working really hard to make sure that we're keeping our patients here, that we're able to provide those services to them here instead of having to send them out. So there's different groups that are working on protocols and guidelines in terms of like what can we safely keep here versus having to transfer out. So I'm really proud of the work that's being done there. And so if you have any suggestions like for the future as to what you would like to see in terms of transfers, just let me know and I'll be happy to include that in the report. And then just moving forward, same stuff, you'll see our quarter data and then for the totals for the average, a lot of good work that's being done. I'm especially proud of the throughput that we've had. I said it, I sound like a broken record, but it's just something really to be proud of. You know, in terms of what we've been able to do with the throughput, making sure that the patients are going in a timely manner up to the inpatient department. This year so code purple is our saturation code. Last year we were every day during the winter, it seemed like we were code purple. That's not happening this time around. Patients are moving quickly. You know, Dr. Nelson isn't reaching out as much in terms of like, we need to get these patients and we need more nurses. And so that's really good work that's happening. And then just lastly, the rest you can, you know, if you have questions, you can ask. I just want to share in terms of the integration, you know, working with Pablo closely and the directors from the El Centro campus and the Pioneers campus to look at our processes and just try, there's a lot of differences. And so we're trying to get like the best from the both areas to make sure that when we come together, there's one process and it's the best process. So, you know, it could be El Centro's process or Pioneer's process, or it might be something like, you know what, neither works. So we're going to look and what's best practices. So that's kind of what's happening right now. And we're focusing on staffing, you know, how we're aligning that. And then also just looking, you know, at how we're going to, everybody's roles are going to be and what the duties are going to be moving forward. And then just looking at the delivery of care and making sure that the strategic plan that was shared here and approved, that everybody has that, they're aware of that, and moving forward, when you see the CNO report, it's going to reflect a lot of that as we're reporting to. So start of the year, if you want to see other things that aren't included here, let me know and I can add that, but you'll start seeing more of those of the strategic plan, which had patient experience left without being seen, some quality metrics that were added in there. And then as we move forward from DNV to Joint Commission accreditation, we'll start providing information on that. So that's all I have. Thank you.
Thank you very much.
I just want to comment, I really like your report.
Yeah.
Every time you do one, you do an extra tweak. So I really, really appreciate all the information you're putting in there. And also too, on your, for your department reports, I really like that as well. And really would like to know the outcome. So if you can just,
We'll do that.
yeah, just do little bulletin on it or anything. But and even transfers are, you know, getting better, and we're still doing desert regional mostly. But yeah, I see UCSD is kind of stepped up there. So yeah, looks okay. I did have a question on the December 25. It looks like urology picked up on transfer.
Yeah, we have seen that. So since I started, the reason why I started breaking it down this way, because I did start to see that, in the other category, it seems to be urology, podiatry. And then you have like the oncology, hematology ones that are there, kind of see that. So I've started to look at those more closely. Usually it's just coverage, we don't have the coverage, so they need to, and there's, now we have Dr. George's.
Yeah, that was my question also too, because I mean, it's neurology, gastroenterology, cardiology, and pediatrics. And I understand, the acuity of pediatrics and cardiology, but, now that we have PSAs with those types of specialties, kind of concerns me that we're still transferring out unless it's acuity.
Yeah, so for the pediatric patients, I can tell you, it's the acuity, although maybe in some instances we can say like, well, we could keep those, but it's what goes along with that patient. Usually if the patient, who might have congenital problems or they need like some specialty service that we might provide it, but not for the pediatric population. So those are some of the things that we're seeing. And again, as we start working all together, the reason why I did it this way is like we could start seeing, okay, exactly what kind of services. So we might think like, is podiatry something that we have to kind of consider, since we're seeing a lot of those going up, and like what parts of that are the ones that are going out. So that's the intent of that.
That's Dr.
Podiatry.
She'll be doing that. Okay, all righty. Thank you.
Here.
Other questions for Carol? I do want to say thank you. I like your reports as well. I always look forward to going through them.
So, and it's always like a work in progress, right? Like whatever you need, we can make that change. But I do want to share, we did reach out to the directors, the leadership for the clinical area to see if they wanted to add something. There wasn't enough time for it, but in the future, this is going to reflect both campuses. So that'll be coming soon.
That'll be great.
Yeah.
Thank you. Okay. There aren't any other further questions. Now we'll get to Carlin's and Laura and the clinical operation.
Okay, so the report is in the packet. If you have any specific questions, let me know. I'll kind of piggyback on the transfer report. I did sit with a few of the GIs. We did ask me to do like a 6-month trend to look at the transfers to see what's going out, to see how they could better help support the community and keep the transfers here. So I'll be working on that with Karen. RHC visits, month over month, we are seeing an increase in visits, so that's a good. Outpatient clinics, the same increase in visits month over month, except for urology. We did have our urologist out last month, so you will see a decrease in our urology visits for the month of December and January. Our urologist, Dr. George's, started January 5th, so it's been a little bit of a slow increase as he gets used to our operations here at Pioneers. He's been doing a lot of going to the doctor's offices. He's had a few dinners with physicians. We met with Balboa and Dr. Gadebo today. So a lot of interaction.
That's great.
Yeah, so he's very proactive. Radiology, I think I spoke about it last meeting, but the 2 MRI techs started this week, full time. So they're currently in training, and then we'll look at expanding our hours and also looking at all modalities to see how we can expand our hours between the both campuses. Our AI scribe, which we're using in our primary care setting in the clinics, for the Pioneers campus, we're at 86% utilization with 14 providers, going well. And we just initiated it in the El Centro Rural Health. And so I'll update you next month on the utilization rate there. And we're also, for notable, our self-scheduling system, we're at 59% utilization to completion, meaning the time they get their appointment via text to the time that they complete it, uploading their insurance card and saying that they're here for arrival. We're at 59% with 85% patient utilization in our women's health. So we're kind of up. We are looking at it. Currently reviewing expanding that on the RCE, CRC campuses as well.
I have a question on your no-show rate. Especially like in the surgical health, even on the patient survey, it was 15%, or what, is that the first quarter?
Yes, that is first quarter. And for the
Fully on.
patient satisfaction rate, I can bring the numbers back, but it's very few patients are responding to it. And then we did have some providers that were missing. So they're currently working on it, making sure that all the providers have had it. No-show rate is high in all areas. So we're currently, when the patients don't show up, we're calling on that day, trying to figure out what the issues are. A lot of it is transportation.
How much telehealth do they do? Your doctors do?
No session. But, yeah, right, that's patient dependent. If they want, you telehealth. Some do, some.
Yes,
But
Yes,
we
it's-
see a lot of, issues also with the no-show, even when you call them and.
yeah, well, I was just talking more or less about the specialty clinics, which the RFC, I understand the no-shows, but as far as the specialty clinic, I'm not understanding why the patient's not getting there. And
There's transportation issues and I spent some time on the floor in Wood Care today because that's one of the areas where we have a high no-show rate. And it's just, they're in the hospital, they're sick and so they can't make it to their appointments. And they just don't call, but then when you call them, they explain what's going on and they just get them back on the schedule. So there is.
it just kind of concerns me because you have like a full-time provider in the clinic and you're paying overhead on the clinic and the patients aren't there. I mean, I don't know how many patients they see a day in the specialty clinics, but if you have this bunch of a no-show, how productive are they?
In the specialty clinics, a lot of the specialty providers, their volumes are in the RHCs. Not necessarily specialty.
So is this number reflective of the RHC?
No, it's not.
So
So they all have days in the RHCs and that's where their volumes are.
well, there's a lot of overhead in those clinics that needs to be,
Overhead.
that's high. Anybody else have a question? Thank you, Clark. Everything okay?
Thank you.
Next report is going on. Thank you.
Yes. I like all the little graphs and memories that they're very easy to read and understand, so thank you.
Try to make them not too small.
Well, the nice thing is now that I've gone with my little computer, I can like go like that and I can make them as big as I need it to be so I can see it. Okay, thank you. So with that, Tomas, do you have anything for us on the urgent care?
These are the numbers doubled from the previous month. They saw 869 patients for December. That's open Monday through Friday, 10 a.m. to 7 p.m. And they were able to keep 8 patients in Calexico and treated at the urgent care rather than send them to the ER. That's a step in the right direction.
Those are expanded hours, from before, weren't they closing early?
They claim that they've always been 10 to 7. And in the past, we got reports from the public that there was one and they were not there. But according to Dr. Tyson, they are open from 10 to 7. And so that was just looking at those hours, they were seeing about 45 patients a day. This is that they were open, so they were concerned. If you recall, the last time we asked was the break even was about 20 to 23 patients. So that was a break even. So it's going in the right direction.
Well, it's flu season too.
Yeah,
They're taking the overflow. Do you ever do like a survey or anything? Have you started to do a survey like from the community?
No, but that's
If they
something that
utilize-
helps you to work with them. Yeah, and that's something that, perhaps we should do one for all outpatient. I mean, I'm just talking at large, right?
Mhm.
Why should we just do it in Calexico
Right.
or the whole county when they think about the services? We look at ER. I've read reports recently that up to 75% of patients that come to the ER and are discharged home could have been seen at an urgent care, right? And if you had enough primary care providers, obviously that would affect numbers in the ER and this impact the ER so we could take those sick people. But it may be doable worth for us to talk about. We want to do a survey. It'd be nice to have a baseline now that we're merging and see what we can do with that. But definitely.
Thank you, Thomas.
This is gonna be yours.
Yes, thank you. Obviously, a lot of the stuff that we've been doing over the last 2 weeks since we talked before has all been centered on having the merger crossing the finish line. And so a lot of our efforts have gone into that, constantly in some meeting or another, whether it's on Zoom, Teams, or in person, to try and push that forward. And so all the team actually has been doing a lot of that kind of work over the last little bit. I will say, just for the board's perspective, one of the things that I think is actually worked out really well is just as we started months ago with the combined executive teams coming together. I think that's really helped gel a lot of that, and we're working really well together, and we're able to have good conversations about things that need to happen and how they need to happen. And so that's something that I really enjoyed being part of over the last little bit, seeing how that's come together. Because it's a lot. It was a lot, and it was a lot to ask for the teams doing that at that particular point in time. And everybody's really kind of stepped up and made that happen, and made that very productive as far as what we've been able to accomplish. And as we've slowly started to merge some of these processes together, as we've had the runway to do so, I think that's going to be very beneficial to us as we keep getting closer and closer to the finish line here. That being said, I will say one of the things that will be coming to you guys, but potentially at the next board meeting or the one after that, is kind of more on that marketing side, right? So we are looking at presenting something to the board with regards to what the actual logo will look like. And so that's something that we're working on. It's not going to be very different. It's going to be a small minor adjustment that we're looking at doing, that will present, or there could be more too. I know there's a process.
Change the whole logo.
So there's a process on that that's happening right now, but we'll bring that to you, and that's obviously going to be very important because that's going to be our branding as we start to move forward and as we start to change the signs. And so there's a lot of work on that. There's a lot of work that's going on with the website as well. We're looking at taking and pushing everything towards the IVHD website and doing an overhaul of that website. So if somebody goes to ecrmc.org or pmhd.org, it just automatically redirects them to the new site. And so it'll have a new fresh look to it. The teams are working on that. We're on the precipice right now of the emails for the executive teams coming together. We are having a Microsoft Global issue right now. And so I know that's kind of had a little bit of an issue, like today, for example, from like 12:03 to 2:08 p.m. I didn't get a single email, which is very odd because there should have been like probably 50. And so there's like weird stuff like that that's happening.
From people that I send
Yeah,
emails.
and it's a Microsoft issue.
That's something wrong with their email.
So that's playing tricks on our process right now as far as that piece goes. But the executive team is first to go on that, and we're going to get to work on all the kinks on that end before we send it out to everybody else after everything's done. So and that's why I told them, I'm like, just use it as much as possible. Let's get all the kinks worked out as we go through that process. But that's where we're at this point. Still a lot of work being done. Team's doing a phenomenal job with that. I know that the staff is doing like constantly day in and day out. They do a phenomenal job with taking care of our patients and taking care of the things that need to happen. And I know that there's a lot of anxiety associated with that, and we're doing what we can to ease those anxieties as much as possible. And it's just a difficult point that going back to some of the conversations that we've had as far as where we're at with the merger process. It's not in our hands. It's out of our hands. We've done what we can. We're waiting on other people, and it's hurry up and wait. I think that pretty sure we talked about this before. I'm pretty sure it's a Tom Petty song, "The Waiting's the Hardest Part" or something like that. So that's where we're at right now. We went
As long
from
as we're not free falling.
exactly. Exactly. So, in football terms, we went from like we were making strides in yards initially, and then we went to feet, and now we're in the game of inches at this point as we continue to inch closer and closer. So that's my report. Happy to take any questions if you have any.
I just wanted to comment that I really appreciate all the work you guys are doing, and I think you guys are doing a good job with collaboration, communication, and keeping patient care centered in all of that mess as well. So thank you very much.
Other questions? Okay, thank you very much. So, Pablo, do you have anything you want to?
No, I think, there's a lot of moving parts and a lot of stuff, but the staff have done a good job in terms of keeping with the pace and the demands for the documents and still keeping seeing patients on a daily basis, and so they should be commended for the great job that they've done. This typically takes about 2.5 years. We've been able to shorten that time frame because of all the hard work of everybody. So kudos to our staff.
I can't really, well, I probably can't speak for all of us. We definitely appreciate everyone's hard work and determination because we felt schizophrenic to where, we have the whole merger and acquisition thing where we have that hat on to make all that work. But at the same time, we're still overseeing a hospital and patient care and the whole point of bringing us all together under the IVHD is to up our game in patient care. And the fact that all of you out there, and the people that I don't see or whatever, I hear great things that everyone is working together. And I just want to make sure we stay on that mission because the people of this valley deserve to have the best. And that was the whole point of bringing us all together. So thank you, because I know it is. You probably feel schizophrenic just like we do because you're trying to get the merger, but then you still got to keep those patients and their care at the top of the list. So thank you. And with that, Adriana, do you have anything to add?
Sort of piggybacking off of that, I wanted to point out and congratulate the board that it's almost to the day, 1 year. January 21st of last year was the day that IVHD took over PMH. And what a year it has been and what accomplishment for this board and your leadership to turn over that hospital board in a seamless way with, a ton of work additionally being done on the merger. As Pablo noted, these deals usually take at least 2 years. I attended a presentation on Children's Hospital of Orange County and Rady's Children's Hospital merger, the general counsels for both of those hospitals. And that deal took 2 years, a little over 2 years from execution of an asset transfer agreement to close. Our asset transfer agreement was approved, I believe, in June, with our LOI being approved in March. So here we are in January, and we're very hopeful for a February close. As Chris noted, it's out of our hands. A lot of it is out of our hands, but we're sitting here waiting and hoping that it will happen soon. And if it does, it would be pretty awesome because the timing and the volume of work that has to be done to transfer a hospital over is not insignificant. But I just wanted to point out the anniversary because it's been a very fun and busy ride for this board. So congratulations. It's been a great year. Thank you. Yep.
Should say thank you because you were the board.
Yes, we do.
Given where we were and where we then and where we're going. I mean,
Oh, and
I'm saying,
I have one more thing. Just so you know, the notice of vacancy for Director Proctor's, former Director Proctor's seat was sent to the county immediately after on January 9th. And it has been posted on the website and at 3 locations here throughout the hospital in compliance with the government code. So tomorrow runs 15 days of posting and declaration of vacancy. So starting at the February 12th meeting, you'll have an opportunity to appoint a 7th board member to sit in Director Proctor's seat, which would run through the November 26th election cycle. To date, I have not gotten any applications other than from Mr. Castro, which I mentioned at the last board meeting. So you can expect to see an agenda item for appointment of a director or at least discussion at the next board meeting.
any other items for the future? I guess I will say one more time if possible, when we have our regular meeting will be held on February 12th. Could we just throw in there where it's gonna be? So,
What do you mean? In the email?
no,
No,
on the, where it says,
Oh.
on the adjournment, you have A,
On the
that,
adjournment part, right?
yeah, the
Oh,
next
okay.
regular meeting of the board will be held on February 12th. And I looked at my calendars and it looks like we're supposed to be in El Centro. And I know we're getting into a rotation, but it just would be nice if you just add that. Since we are in multiple locations, just add that on there.
Okay, she might be calendar, and that's, okay, I'll do that change.
Yeah, thank you. And kudos to Brenda because she's learning at warp speed too and doing a very good job. So thank you.
Thank you.
All right, with that, does anyone have anything else? If not, I will adjourn this meeting at, I guess it is 7:40. Thank you, everyone.